Hey everyone, I wanted to talk about circumcision for a minute. It's one of those things in the newborn period that you certainly have the option to either do or not do, but you definitely want to do it in the first 2 weeks. That way the baby is as still as they can be. Otherwise you'll need surgery and anesthesia. So, circumcision is like a lot of things with us at Thrivewell Pediatrics, where we have one foot in either side, and we understand the thinking and the feeling of parents that decide to do one thing or the other. What's important to understand is that in the rest of the world, circumcision is less common. When you look at the statistics of around the world altogether, it's maybe 35, maybe 40% at the most. And that has to do with certain countries having different opinions in certain religions. So the Muslim religion and the Jewish religion definitely always circumcise. The Hispanic community is significantly not circumcising. And in China and Asia, mainly they're not circumcising. So there's a lot of people around the world that do not circumcise. And then when you look at the United States, it depends on where you live. So if you live, say, in the Midwest, it's very high, maybe 75, 80% even, depending on the year. And then when you live in the West, in the mountains and out west, it's a lot less. It's the opposite. It's maybe 20 to 30%. So it just depends on where you live, whether and what culture you come from and how your family was dealing with this situation, whether you think that it's the right thing to do or it's the best thing to do. Medically speaking, it's been a flip-flop. In my career, the AAP, American Academy of Pediatrics, and the Medicaid organization, which really, whether they approve to pay for something or not, is kind of how other insurance companies make their decisions on the same thing. So these two organizations have flip-flopped in my career 3 or 4 times, whether circumcision is going to be approved and they'll pay for it or it's not. And what that's based on is that there are studies that show that it's better to do it or better not to do it based on potential side effects. So if you come from one of those camps, just know the other camp is actually about equal in terms of those things, except for the fact, I would say, that the prevention of sexually transmitted diseases like HIV especially are more common and passed on more from men who are uncircumcised. So there was a big push in Africa, and still is ongoing, where they didn't usually circumcise, to circumcise boys in infancy in the gentlest way, so that they could decrease the horrible amount of HIV that was passing around in the country. And it's been an effort that's been very successful. So it just depends where you live, your religious beliefs, your cultural beliefs, your family, what heritage or what has happened in your family and where you're from. And then what we always encourage parents to do is we inform them, both sides, and hope that they think very cautiously about it, because it is an invasive procedure. It is surgery. It has risks like bleeding and infection, and especially not looking like you thought it was going to look, because it is a cosmetic surgery. So I hope that helps. If you do have any questions from this discussion about circumcision, please put them down in the comments and we'll answer them quickly as we can. Take care.